Moving on, next topic, anthelmintics. In this topic, outcome of the topic is study about different types of helminthic worm and mechanism of action, pharmacology and drug interactions of anthelmintic drugs. Okay, anthelmintics are the drugs that is used for the treatment of helminthic infection, and helminthic are of three types. First one, nematodes. Also, they are known as a roundworm. Example, Ascarias, filarias. Example. Okay, next one is trematodes. Trematodes are of fluck worms, liver flax and lung flax. And next ones are tapeworms. Tapeworms are of different types: Tinea solium, Tinea saginatum, etc. And anthelmintics are the drugs may act by two mechanisms. First mechanism is vermicidal action. Second mechanism is vermifugal action. Vermicidal action is these drugs act by killing the worm, and second mechanism is vermifugal action. These drugs expel the worm in the intestine. Okay. Next classification of drugs. First classification is Benzimidazole. Example, Albendazole, Mebendazole, Thiabendazole, etc. Next classification is quinolones and isoquinolines. Examples are oxamnicum, praziquantel. Next classification is piperazine derivatives. Example, piperazine citrate. Next one, vinyl pyrimidines. Example, Pyrantel, pamoate and Oxantel. Next one, amides. Example, niclosamide. Next, natural products. Example, ivermectin. Moving on, first classification, benzimidazole. These are heterocyclic aromatic organic compound, and these are bicyclic compound, consist of fusion of benzene and imidazole ring. These drugs act by two mechanisms. First mechanism is these drugs binding with beta tubulin, and this causes the inhibition of mitotic spindle formation and arrest the mitosis phase. And second mechanism of action is these drugs act by blocking the glucose reuptake in the parasite and inhibit the depletion of glycogen storage. Okay. Next, moving on, pharmacokinetics. These benzimidazole drugs are poorly absorbed from gut and also undergo first pass metabolism. And fatty food enhance the absorption of benzimidazole type of drugs, and it is extensively bound to plasma protein and easily distributed, and it is metabolized in liver. Adverse effect including nausea, abdominal pain, diarrhea, and large doses of drug may causes CNS side effect and also causes granulocytopenia, and these drugs should be avoided in pregnancy condition and also in children's age below 2 years, because in case of children having less than 2 years, their liver should not be matured. Okay. Uses of these benzimidazole type of drugs used in the treatment of roundworm infestation, hookworm infestation, pinworm, tapeworm, trichuriasis and hydatid diseases. Okay. Moving on, first drug, albendazole. Albendazole is a congener of mebendazole. It is a prodrug and is active metabolite, and it having good efficacy against roundworm, hookworm and pinworm infestation. Moving on, mechanism of action. This drug is bind with the beta tubulin and inhibit the polymerization that block the mitotic spindle formation and also stopping the mitosis, and it also arrests the cell division phase of helminthic worm, and it also inhibit the second mechanism, inhibit the uptake of glucose and leading to the depletion of glycogen storage. So the reduced formation of ATP and the death of the helminthic worm should be obtained. This chart show the mechanism of action of benzimidazole type of drug. First, it is show first parasitic worms that bind with the microtubule there is two type of tubulin, alpha and beta tubulin, but our drug will be bind with the beta tubulin, and it inhibit the polymerization or assembly of microtubule. It will inhibit the mitotic spindle formation, and it also causes the mitosis, arrest the mitosis phase, and it causes the inhibition of cell division phase. Okay, next one, pharmacokinetics. It is readily absorbed from the gut, and fatty food should be enhance the absorption, and it penetrate the all of the tissues, and it is metabolized in liver, and it should be excreted through urine, and it should not be administered with pregnant women and also children having less than 2 years old. And adverse effect including nausea, diarrhea, abdominal pain, headache, dizziness, allergic reactions, jaundice, fever, alopecia, etc. Similar that of all benzimidazole type of anthelmintic drugs. Uses including roundworm infection, pinworm infection, trichuriasis, neurocystic sarcosis, hydatid infection, and also filariasis. Filariasis is caused by causative agent Bucheria bancrofti. Next drug is thiabendazole. Thiabendazole is also act like mebendazole, and it having adverse effect including dizziness, anorexia, vomiting, diarrhea, etc. And mechanism of action is similar to that of albendazole and mebendazole, and blocking the beta tubulin synthesis and also inhibit the glycogen storage. So adverse effect should be more than that of other drugs, so it should not be preferred. Okay, and in case of strongyloides, it is alternative drug for albendazole. Next drug is Pyrantel pamoate. Pyrantel pamoate is poorly absorbed from gut. It acts on the worms in the gut, and it is well tolerated, and it causes abdominal pain, headache, rashes, weakness, and dizziness may occur. Mechanism of action including first of all, it bind with the nicotinic cholinergic receptors in worms, and it causes persistent depolarization of neuromuscular blocking agent, and it causes the release of acetylcholine and inhibition of cholinesterase enzyme, and it causes the spastic paralysis of worm, and it causes the loss of muscle grip, and it falling down from intestinal mucosa, and causes the elimination of this worm through stool. Okay, spastic paralysis causes irregular contraction of muscles. So grip is reduced, falling down of worms occur, and different type of skeletal muscle relaxant should be act like this mechanism. Uses including roundworm infection, hookworm infection, pinworm infestation, etc. Next class of drug is Oxantel pamoate. It is an analog of Pyrantel pamoate and is effective against trichuriasis infection. Mechanism of action is first of all, it will bind with the GABA agonist and causes of chloride channel opening, and it causes the hyperpolarization of ascaris muscle, and it causes the relaxation and decrease the responsiveness to contractile action of acetylcholine, and it causes flaccid paralysis. Flaccid paralysis means muscle weakness, and elimination of worms in stool may occur. Adverse effect including it causes mild GI symptoms, headache, dizziness, etc. And this drug is safe in pregnancy and used in roundworm and pinworm infections. Okay. Next one, levamisole. Levamisole is an immunomodulator drug, and it acts by primarily on acetylcholine receptor and causing the opening of ion channels, and causes the increasing influx of calcium channel, and it causes the depolarization of muscles, and it causes the spastic paralysis and falling down of these worms from intestinal mucosa and causes the expulsion of this worm through fecal matter. And also it inhibited the conversion of fumarate to succinate, and it inhibited the formation of ATP from this conversion. Okay. And uses are including it used for the treatment of hookworm infection and roundworm infection, and it also used as an immunomodulator like immunostimulant action. Okay, next drug is niclosamide. Niclosamide act by inhibition of oxidative phosphorylation or stimulation of ATPase pathway and causes the depletion of energy storage and injured or expulsion of worm through fecal matter is obtained. This is the mechanism of niclosamide and used in the treatment of tapeworm infections and fluk infestation like liver fluk and lung fluk infestations. And moving on, next drug is a praziquantel. This mechanism of action is similar to that of levamisole, and it increases the influx of calcium into the tegmen and increase the muscular contraction and causes the spastic paralysis of worm, and it causes the vacuolization and disintegration of tegmen, and death of the parasite will be occur. This parasite will be expelled through fecal matter. Okay, adverse effect including GI disturbances, headache, dizziness, etc., and used in the treatment of schistosomiasis, tapeworm, and neurocystic sarcosis. Okay. Okay,